Okay, hello friends. Myself Dr. Sanjeet Kumar. Today we are going to start hydrogen sulphide or knockdown gas. Features of hydrogen sulphide: it is colorless, heavy and flammable gas. Rotten egg smell. It is found where the sulfur containing organic material is undergoing decomposition. Organic material is undergoing decomposition like sewers, septic tank or coal mines, etc. It is formed in human intestine during life and in the dead body when the putrefaction set in. Hydrogen sulphide in combination with methane, nitrogen, hydrocarbons, ammonia, carbon dioxide formed in the sewer is known as sewer gas. तो सीवर गैस में क्या क्या है? हाइड्रोजन सल्फाइड, मीथेन, नाइट्रोजन, हाइड्रोकार्बन, अमोनिया एंड कार्बन डाइऑक्साइड. It is heavier than air. Normal tolerable limit 20 ppm and more than 100 ppm is dangerous to life. It burns in air with pale blue flame forming sulfur dioxide. Then fatal dose is 0.2% concentration in air would be fatal in few minutes. 400 to 700 ppm is dangerous after an exposure to half an hour to 1 hour. More than 1000 ppm is instant death. Then fatal period few minutes to few hours. Mechanism of action: it is highly poisonous gas acting as a local irritant and affecting CNS. It converts oxyhemoglobin of blood to methemoglobin. In the body after death, this reaction proceeds further. There is formation of sulf-methemoglobin. This reaction is not seen in living body. Hydrogen sulphide interfere with cellular respiration by inhibiting the action of cytochrome oxidase. Then clinical feature: in great dilution, there is feeling of dullness, sleepiness. Death may occur during sleep without the victim regaining consciousness. If weak concentration, then it produces nausea, cough, abdominal pain, lacrimation, photophobia, giddiness, delirium, convulsions, labored breathing, pulmonary edema, bronchopneumonia, irregular heartbeats, coma and death. If pure hydrogen sulphide is inhaled, death occurs at once from the paralysis of respiratory centers. Recovery: associated with impairment of vision, hearing, smell, memory loss, ataxia, rigidity and tremor. Then treatment: the patient should be removed at once to fresh air, artificial respiration with 100% oxygen, amyl nitrite inhalation and sodium nitrite infusion. It hastens the formation of sulf-methemoglobin and supportive treatment. Then postmortem finding: signs of asphyxia, rotten egg smell on opening the body. Postmortem staining is bluish green color, rotten egg smell and signs of asphyxia is bluish green appearance of postmortem staining. There is tendency to rapid putrefaction. In some cases, the color of organ is dark brown than normal color due to postmortem combination of hydrogen sulphide and methemoglobin. Color of blood, viscera and bronchial secretion is greenish purple. Then medical importance: always accidental, especially in the sewer worker. Detergent suicide. So hydrogen sulphide has recently been implicated in the suicides in Japan. So बोलते हैं detergent suicide. Gas mask: workers going down in the sewer lines to clean them must wear gas mask, otherwise death occurs immediately. Employers liability to pay compensation in cases of occupational disease due to hydrogen sulphide exposure. This is the medicolegal importance. Then important question of carbon dioxide poisoning. Examples of simple asphyxiant gases includes all except carbon monoxide, methane, helium, nitrous oxide. So carbon monoxide is not a simple asphyxiant. Mechanism by which carbon dioxide can cause poisoning is combining with hemoglobin to form a stable compound due to inhibition of cytochrome P450 oxidase by mechanical obstruction of tissue from obtaining oxygen, by inhibiting the respiratory center. So by mechanical obstruction of tissue from obtaining oxygen. Sometimes accidental death occurs when a person enters into the long unused well. It is usually due to methane gas, hydrogen sulfide, carbon dioxide and carbon monoxide. तो कार्बन डाइऑक्साइड अनयूज्ड वेल है तो कार्बन डाइऑक्साइड. इंपॉर्टेंट क्वेश्चंस ऑफ हाइड्रोजन सल्फाइड पॉइजनिंग. रोटन एग स्मेल इज ड्यू टू पॉइजनिंग ऑफ कार्बन डाइऑक्साइड, कार्बन मोनोऑक्साइड, हाइड्रोजन सल्फाइड और नाइट्रस ऑक्साइड. विच टॉक्सिक गैस इज पॉपुलरली नोन एज सीवेज गैस. मीथेन गैस, हाइड्रोजन सल्फाइड, फॉस्जिन गैस और नाइट्रोजन डाइऑक्साइड गैस. Accidental death may occur in workers while working in the sewer due to poisoning from hydrogen sulfide, carbon dioxide, methane gas and carbon monoxide. This is all about hydrogen sulfide. ये 3 क्वेश्चन का आंसर कमेंट में करना है, फिर नेक्स्ट वीक में से आंसर बताएंगे. थैंक यू फॉर वॉचिंग.